on here.
I am Lynn Rupi's husband, and I'm acting as the host. So tonight, Tim will introduce our speaker shortly, but just want to let everybody know we videotape these meetings and they're published on YouTube. So if you have something you want to speak during the question and answer period that's confidential, or for whatever reason you don't want it recorded, just raise your hand or let us know and we'll turn it off, make sure it's turned off, and we can talk about that issue, and then we'll resume that. There's during the question and answers, there's three ways you can get our attention. You can literally raise your hand. There's the reactions at the bottom of your screen. You can click on pop a hand up there, or you can send out a chat. I monitor that as the host. I'll do my best to keep us in order. But if it stacks up and you get overrun a bit, I'll send you a text, say, hey, I know you're there, and we'll get you in as best we can. These questions are fantastic. We're hearing from Dr. Dennis from the physician's point of view, but what you all bring is a patient's point of view, which is the blessing of that is ongoing because it's published, and somebody 2 years from now may watch this and say, "Oh man, I have the same thing." It's amazing. So you are not only blessing this group, you're blessing everyone who watches it down the road. So thank you all for participating. I think that's it for me. With that, Tim, I'm going to let you decide when you want to start the meeting off. And again,
we usually give it 5 to 10 feet. Is
Sure.
Dr. Dennis on yet?
Yep.
Yeah.
Okay.
Maybe we could have Laura
Yeah.
pop in if we have a few minutes to wait for other people. Hey, Laura, it's so good to see you. Yay! This is Dr. Ken Casey, our famous neurosurgeon here. His wonderful daughter who rallied all over the world to find him a donor, and she did it, and he did it, and I heard he's out of the hospital. Is that true?
He is.
Oh my gosh.
He is.
So
for those of you who do not know me, I'm Laura. I'm Dr. Ken Casey's daughter. Unfortunately, he is not able to come on tonight. He is continuing to recover from liver transplant surgery, which he received 2 weeks ago. So for those of you who don't know, the past 2 years, my dad went through COVID, and then from there went into liver failure. From there went into liver disease, and unfortunately wound up getting hepatitis C. How, we don't know. That is still being figured out and processed. I decided when my dad went onto the liver transplant list last year, December, the day before Christmas, I decided to create a Facebook page to kind of raise some awareness regarding my dad needing a transplant and needing a donor, and kind of generate some information on liver disease and liver failure and how it affects the person on an everyday basis and how it affects the family. And we had over, I believe last I counted, we had over 6,000 people who shared and posted and went out and put out the information regarding my dad's information and his story. And because of so many people rallying together and becoming an army, basically an army, that's what I call it, Team Casey Army.
Yeah. I love it.
We were able to find a donor, a confirmed match from dad.
Yeah, a live donor.
Yep.
A live donor. That's not easy to find. Yeah.
No, not. And happened 2 weeks ago. My dad had the surgery. I got the phone call on a Wednesday afternoon, went into surgery Thursday morning at approximately 5:45 a.m. and it lasted 10 and a half hours. So it was a pretty much all day procedure. But he is doing well. He is going to be remaining in Pittsburgh until at least the end of the month, just to make sure that things continue to progress well and his body continues to respond to the new liver. He's still on some of the medications as before, but not all of them, which is great. But still, just make sure that there's no infection and no setbacks. So that is the great news regarding my dad. And thank you to everybody who sent cards and packages with different things. The Get Well emails and phone calls and texts went a long way. So again, just thank you to everybody, and just know that he will be home here in Detroit. Hopefully, we're hoping July 1st if things continue to go well. So that is the news where things are at right now.
That's fantastic. So glad to hear that.
Mm-hmm.
That's great. Thanks, Laura. Any questions?
I
Are there
missed
any
that.
questions for Laura?
Any questions? Sorry, the voice is not good.
No, I think you've done an excellent job keeping us all updated, Laura. We're
Thanks, Laura.
celebrating every step of the way with you.
Not a problem.
Yeah, well, I want to see that hug picture posted when you get him around.
We still have to wait. Unfortunately, when he gets home, we'll have to wait another month or two before we can actually do that, just because we have to make sure, like if somebody gets back home, still can't be around a lot of people. We got to wait until he's completely cleared from his doctors to make sure everything, goes well, continues to go well. So,
Yeah.
but we will be back together soon enough, and
Oh,
we won't
that's
have to worry about
fantastic.
more hospitals and all that. So
That's fantastic. Well, please
Wonderful.
tell him we're all just rejoicing with him and your mom, and so happy to hear that this is going so well.
absolutely well.
All right.
And
Thanks,
again,
Laura.
thank you, everybody, and
Okay, thanks, Laura.
we'll keep you guys updated. See
Okay,
ya.
great.
Thanks.
sweetie.
Yeah, you're welcome. Bye.
Bye.
Before we begin with Dr. Dennis, just a quick note. Most of her background is in the note, not all of it, but a lot of it is in the note that Lynn and I sent out. I'd also like to say that since Lynn found Dr. Dennis on Facebook, I've had other members that have listened to Dr. Dennis. One recently, Barb in Toledo, wrote to me and said, "You must have Dr. Dennis speak to our group, Tim," because this was before the note went out this last week, because she's got so much information on TN and possible relations to TMJ. So you got a lot of support from, I thought Barb was on earlier. I don't see her now. But with that, we'll let you start out unless Lynn has some comments as an intro. Dr.
I'm just thrilled you can join us tonight, Dr. Dennis, and you've done such a nice job helping people on the Facebook facial pain site that we knew you'd be awesome, and I'm glad you tracked us down and we were able to meet and get you going here. This is awesome. Thank you for joining us.
You're very welcome.
Just one other, and I may have brought it up to you. The neurosurgeon we had speak in April talked about the total trigeminal neuralgia, atypical neuropathic facial pain group. And in his opinion, only 10% of that circle or population was classic TN. And he said there's so much else out there in that. I think I raised it to you earlier on, in making up that 90%. So I'm not asking you to define how much is TMJ related, but anything that comes into your mind that, for example, mine was infected root canal, other issues that people who, again, like Pete said, people will be watching this over the years, hopefully. Somebody watching it might not think that they have TN or TN related. And anything you can add to that would be great. Go ahead. Okay. Thanks.
Okay.
Barb just popped in, Tim. Excuse me.
Oh, okay. Hi, Barb. I was talking about you, Barb, so I'm glad you weren't on.
So I'm an orofacial pain specialist, which is the new 12th specialty in dentistry. So we're brand new, sort of, but I've been practicing for about 25 years, doing just pain management. So I see a lot of jaw joint damage patients because that's where I started. But I actually think about 50% of the ATN patients have jaw joint damage. And so when I answer questions online, every single day I can answer one that I think is a jaw joint problem. So I really want to get the message out that it's something that's fairly easy to find out. And if it is, it's a fixable thing. So The neurologists never say anything about your jaw joints. Nobody says anything about your jaw joints. And so that's what I do, is talk about jaw joints and then pain, any kind of facial pain. We do chronic regional pain syndrome, migraine, just anything basically. So I'm going to show you a little quick PowerPoint. Maybe, yeah, okay. And basically this is just a few things that I've put together. And so basically when I'm talking to people online, I use the word TMJ or term TMJ because that's what everybody knows, but I don't like it at all because it's an abbreviation, and what it means is temporomandibular joint. So it's a layman's term to mean any pain above the shoulder. So a lot of people say, oh, it's just TMJ. Oh, you have TMJ. But if you got a diagnosis of knee for leg pain, you think that doctor was crazy. And that's what we're doing when we say you have TMJ. We're saying you have knee, you have elbow, you have shoulder. It doesn't mean anything. And so what you would say is, well, what's wrong with my knee? And that's what we need to do. We need to find out what is wrong, if anything, with the jaw joint itself. Just like you would if you went to the doctor with leg pain. They wouldn't say, well, you have knee, see ya. They'd say, okay, let's get an MRI of that knee and see if there's anything wrong with it. So I prefer the terms facial pain related to nerves, to joints, to muscles, but there's still a long way to go for me to get that. So I use this just because that's what most people are understanding when I'm talking. So one of the things that I've noticed in my practice when I'm looking at a TN versus a TMJ patient is that the TN people will usually, and these are general things, but not touch their face. They'll say, I have pain here. Whereas a TMJ patient will say, oh my gosh, I have so much pain right here, and they'll rub that area. And a TN patient generally doesn't do that. So all right at the very beginning, I'm looking and I'm thinking, oh, this isn't TN. Okay. Some of the problems, though, are with TN. I like the lightning-like pain because that's pretty diagnostic. But one of the other problems that I see is the pain is constant in the area of the trigeminal nerve. That's also TMJ patients. That's also TN patients. I mostly see atypical kinds of TN. I rarely see typical kinds. I think that's just because maybe the typical kinds do get treated more easily at the neurologist. The other thing that makes me think, TMJ problems is bilateral. It's not that TN can't be bilateral, it's just not normally bilateral. So again, a bilateral makes me think TMJ first. So when I do an exam for a TN patient, I can touch all their muscles, all their teeth, everything around their face besides their trigger area and find nothing. And their bite will be stable. Their face will be a normal dimension. When you put your finger from your nose to your chin, your finger should be pretty much straight up and down. If it's not, if it's usually behind a retruded chin, then that always makes me think jaw joint problems too. And the TN patients won't have a history of trauma necessarily. And some TMJ patients don't remember their trauma either, but a lot of times they have had trauma. So when I'm looking at the TMJ person versus the TN person, they'll complain of pain in the jaw joint itself. That's not generally the TN person. They'll complain of pain in the facial muscles, the masseter and the temporalis. Again, that's not generally the TN person. Headaches and temple pain. I almost always find a jaw joint problem with these people because headaches are not necessarily related to trigeminal neuralgia, but I see that all the time on the sites. If you have bite issues, worn teeth, broken teeth, loose teeth, that kind of thing, that's a jaw problem. If you're a clencher grinder, now you can clench and grind in response to pain, and sometimes you have to put that in, but a person that clenches and grinds is a person that's trying to fix a bite discrepancy coming from a jaw joint problem. If you've ever had stitches in your chin, you have a jaw joint injury. If you have a retruded chin or buck teeth, or you had orthodontics very early, those are also signs of jaw joint problems. Some patients with TMJ problems have limited opening and noises on opening. My patients rarely do, because the more injured you are, the less noise you make. The smaller the jaw joint is, the less noise you're going to make and the more opening you can have. So this rarely happens in my practice. I rarely see limited opening. Okay, so the thing we do, just like the knee doctor does, is get an MRI. So this is a normal jaw joint on MRI, and this is the disc in where it's supposed to be in the open and close, and this is a disc out in front. So that's fairly easy to see. It's not like you have to, you know, really look carefully for it. This is something that we can see very readily. When the disc is in place, there's nerves and blood vessels behind it. When it's out of place, those nerves and blood vessels come on top of this. So every time you speak, swallow, and chew, you're compressing these nerves and blood vessels. So the reason that this sometimes gets confused is that there's a branch of the trigeminal nerve that only goes through the jaw joints, and it's called the auriculotemporal nerve. Okay. So if you found out that, yes, I do have damage on the MRI, I want to see how much this jaw joint damage is contributing to my facial pain, you do an auriculotemporal nerve block. So all this block does is numbs this particular nerve right here. It doesn't numb the rest of it. So if you numb this nerve and your TN pain stops, that means you have a jaw joint problem and your pain is coming from the temporomandibular joints, not from just the nerves. So that's a fixable situation. All joints are fixable. And so if you can have no pain to this block, you can have no pain, period. Has to be done correctly, but that's an easy way to find out if this is a TMJ problem or true trigeminal neuralgia problem. So that's my little, how do I unshare? Stop sharing. Okay. So that's just my little presentation. So I can answer any questions or I can keep talking. So, you know, anything that you guys want to talk about.
And it was really interesting. My sister has jaw joint problems, and she fell as a little girl and hit glass bottles that my mom had stored along the refrigerator, and she lacerated her chin, but I never put that together.
Absolutely. I would bet almost all my patients have childhood trauma. And the way that you know that they have is that when you look at the picture of the jaw joint and the condyle, if you look at it from the top, it should be 8 by 20 or 160 square millimeters. If it's not 160 square millimeters, you were injured prior to puberty because your bone didn't grow. Right. And I don't have any patients that are normal. None of my TMJ pain patients have normal condyles.
Seamus, are you listening?
Yeah, she totally hit me on the face because that's where all my stuff happened. Yeah, she's got me.
Out in California.
So yeah, my face, all the bones were broken when I was 15. I think they reconstructed the right side, but constant pain left side. So that's where last time I saw the oral facial pain specialist, he thought maybe there was arthritis in the TMJ, but the jaw was wide.
Arthritis is a very common finding, and it doesn't mean anything. You have to know why you have arthritis, and why are they guessing? Why don't they just look? You know, they fixed your whole entire face and never looked at your jaw joint. That makes me so mad I can scream.
Oh yes, ma'am. I've been it's like been a Stephen King movie for me since age 15.
Absolutely. I totally believe you. That's my normal patient. You're my normal patient. You know, that has that, they have some kind of trauma that never gets looked at.
But it's hard to get to you because insurance won't pay for you. So then, gosh. So like this week again, I see a face or just a pain management, and I'm not sure how they'll treat me, but right now I pain manage it.
The problem is that you need a diagnosis. You don't have a diagnosis of what's wrong over there.
Yeah, he kind of said TMJ, amygdala, or something like that. And then, like you said, there's conflicting opinions, and no one's like standing their ground, being like,
yeah, that should not be a diagnosis. They would never say that you have elbow, you have shoulder. They don't say that. They don't say you have shoulder disorder. They don't say that. So, you know, that's what makes me so mad is that you've suffered. How old are you now?
42.
Okay. For 20, you know, some years, 30 years almost, they stick to this terrible diagnosis of TMJ and nothing can be done.
Mhm.
And they just say, oh, you have TMJ. You
Yeah.
know, my sister was injured in a car accident. She broke her collarbone when she was 4. And by the time she was 35, her jaw joints had completely disintegrated away. And the surgeon told me to take her to a psychiatrist. And that's
Right.
kind of what got me into this, is because I was like, yeah, no, that's not going to work.
That's beautiful. So in my case, like, I'm just told I kind of pretty much need to pain manage it and then do daily good activities, because like they do the range of motion, set it all. But like you said, they don't really give a treatment plan for me.
If you haven't had an MRI of your jaw joint, they have no idea what's wrong.
Okay, I'll try and get that accomplished too.
Now,
I
if
think
you
in 2007, and they said they were subplexed.
Yes, they do.
The condyle and the mandibular were subplexed, but I don't know if that's right. And it could have been a CT, but
Right.
MRI.
Well, if you'll just PM me, I'll send you the protocol that I use for my scan, and then you can take that to any doctor and see if they'll order it for you. And as you send me the report, I'll explain what it means to you.
Thank
Okay,
you,
can we just time out for a quick second? We're getting a lot of feedback, so anybody who's not speaking, please mute.
It's Seamus's mic. There's a bounce going on over. There's a delay.
Yeah, my caregiver was making a lot of noise. I'll keep it on mute.
There you go. Thanks, Seamus. We have excuse me, my phone's going. Doctor, we have a question from Teresa Perlman. Teresa, you want to ask about your TMJ question?
Sure. Hi, Dr. Dennis. So I have read that TMJ or TMD can cause trigeminal neuralgia due to inflammation of the jaw joint and then causing inflammation of the nerve, and then it'll damage the nerve, which is maybe why sometimes somebody might get the shocks as opposed to the lingering burning pain. Yep. What are your thoughts on that?
That's just what I was talking about. Exactly what I was just talking about. Yeah, the jaw joint is innervated by the auriculotemporal nerve, which is the second branch of the trigeminal nerve. And so the damage inside the joint is what causes the inflammation inside the joint, which is what irritates the nerve. And so, yeah, it can damage it. And because the way that the nerve works, when the nerve is damaged, it secretes different things that make the nerve get damaged all the way up to the brain. So that's why sometimes even cutting the nerve doesn't work, because the brain has already changed the way that it sees things. And so that's why it's so important to get diagnosed with this TMJ problem early, because then it can't damage the nerve permanently. And so a lot of people say, oh, you can't fix TMJ problems. We'll wait until you're locked shut. At the University of Florida, they won't look at anybody's jaw joints until they're actually physically locked shut. By then, you've been in pain for 40 years or, a long, long time. And there's just it's not good by that point. I mean, we advocate fixing as soon as we find out. We've had a 9-year-old patient, a 12-year-old patient. We have lots of 16-year-old patients to fix that joint so that that nerve doesn't get damaged. So it is the inflammation that's the problem, but it's the thing that causes the inflammation. It's the thing that causes the arthritis that's the problem. But that's absolutely 100% true. And that's why I get so upset, because nobody ever looks at it. These doctors that are so wonderful. I'm not a big fan of neurologists. I know we have to have them, but they're not my favorite people because they refuse to look at jaw joints. Nobody looks at them.
I just have one more quick question, then I'll stop. Would you recommend that anybody with TNC, like an orofacial pain specialist, if they're having like jaw pain? I guess I'm trying to figure out if I should go that route or not.
Well, you have to find somebody that's going to get the MRI. And so not all orofacial pain specialists do. In fact, they mostly don't. It's kind of weird. I'm one of them, but not one of them, because they don't look at jaw joints usually either. So I did this because of my sister, because I went through this whole years and years, just terrible migraine patient, horrible migraine patient, just for years and years and years. And finally I was like, okay, nobody's fixing this, so I guess I need to figure this thing out, you know. And that's when we went and got the MRI. And if your jaw joint's supposed to be this big, hers was this big. And that would be like having a ball part of your hip being that big. That would hurt. You know, if you had a shoulder that had that, it wouldn't work. You know, so your jaw joints are the exact same thing. So anybody that has any kind of noise for sure is damaged. But any kind of pain, you know, in the ear pain is my number one symptom. Pain on chewing, which it can be confusing with TN, but most people will say it hurts in their jaw joints, where most TN patients will say it kind of hurts like here, you know. Any kind of bite problems, any kind of teeth problems that they can't explain, like, yeah, no, I don't chew ice, no, I don't eat rocks, you know, why are my teeth breaking apart? Any kind of headaches. And number one, if anybody comes in here that has a headache, they get a scan. One, I want to make sure they have a brain tumor, because my first TN patient in this office had a brain tumor. I said, oh, nobody ever has a brain tumor. We're just going to get a scan to make sure you don't. Yeah, she did. And so I never say that anymore. So I will scan anybody, but if they have a headache, that's not a typical TN thing. So headache.
What's the scan you're referring to?
Well, I get a jaw joint, but extra. I have a protocol that I use that I get deep face, brain, jaw joints. I get everything. I look for any kind of pathology in there.
It's not an MRI then?
Yeah, it's an MRI.
Oh, it is?
Yeah.
Don't you think it's the expense of an MRI that stops people from other people?
I don't have any problems getting it covered. No problems. Okay. And if there's somebody that has like a large deductible, like we have some people in Jacksonville, their big companies have a $10,000 deductible. Yeah. They'll have a cash price of $450. So there's absolutely no reason not to get a scan. Absolutely.
Good point. Seamus, did he leave?
Oh no, he's still there.
He's there. Okay.
No, I'm here.
If you got a problem, let me know, Seamus.
I've had Medicaid cover them. Medicare covers them. Everybody covers them. If you do you sometimes have to write a little letter, but you just write it, you know, I mean, it's not a big deal to get it. And I have this protocol that I've developed, and even if the place won't do the whole protocol, at least they usually will do some of it. And that gets me to scans, because I've looked at people's scans that have one slice of jaw joints on there. It's not going to do it. You know, they don't get one slice of your brain. Why do they get one slice of jaw joints?
Pete, you're up. Who's your next question?
There are no other questions. Other questions, Dr. Dennis? I've been just.
Sorry, Pete.
No, you're fine. I was trying to think of some questions, but you're really covering a lot of bases here, Dr. Dennis. This is fantastic.
And you're right, neurologists, they're so general. Sometimes they just pass you around, and then. Yeah. So I might have gotten the MRI done before. So it's very difficult, even if you relocate to another city, if that makes sense.
Yeah.
Mm-hmm.
But you got to have one with the protocol, Seamus. You understand that? The old one's you got to get her protocol to do the new one.
And I can send it to anybody. Right. I don't mind sending it out to anybody.
Cool. I look forward to it.
I can give it to him. But whatever.
It'll help me out.
Yeah, all right.
Looks like Jim Evans has got a question, Pete.
Now, I've gone through the MRI route, and I have a report which I sent to, well, actually, a neurosurgeon has it now, and I haven't seen him. My neurologist saw it, and he said, well, it's kind of benign. It kind of doesn't show anything. And I passed that report on to my sister, who's a sports medicine doctor. And she looked at it and didn't see anything either. But the report, I think, is kind of benign, or they didn't do the MRI in the right detail.
For your brain or your jaw joints?
No, it was my whole face, my whole head.
Okay.
And I don't know, can I send you that report? And
Well, if it doesn't say anything, I mean, I can't, I mean, I can't really, I mean, I can explain if there's something on there, what it means, but if it says nothing's there, I can't really help too much with that. And the face MRI doesn't get the jaw joints in enough detail to know usually if it's a jaw joint problem. It has to be a jaw joint specific MRI.
okay, so
what they were looking for was pathology.
So I would be looking at another MRI done with a different point of view.
Yes.
Okay.
Yeah. And I can make that available to anybody, that protocol. It's, I can help. I can send you anything you want me to send you.
Well,
I'd be happy to give anything away.
Can I get a copy of your protocol?
Absolutely.
Send that to me, Doc, and I'll get it to those two, please.
Yeah, I have no problem with that.
Can a cone being scanned show something in your face?
Yes and no. It can show the damage that's there to the bone, but it doesn't show what caused that damage. It doesn't show where the disc is, and we have to know where the disc is. The problem also with that disc being out of place is, like, if this is the jaw joint and the disc is out here, it blocks the blood flow to that bone and allows that bone to degenerate. So that doesn't show on the CAT scan. It shows if it is degenerated, but it doesn't show where that disc is out here. So it has to be an MRI.
Okay, because I have terrible facial pain on the right side. It's constant, and then in my chin will burn, like on the side of my chin. That's where one of the branches are, right?
Yep, the trigeminal nerve goes everywhere in your face.
Who's talking now?
In your face.
Tony Mendocino.
Oh, Tony. Okay.
Yeah, that's the problem. Is it's the whole entire face, and that makes it very difficult to live with any kind of nerve pain, because you use your face for everything. I mean, you know that, but I mean, it is really horrible to have facial pain.
Yesterday, the doctor, he's a dentist. They're dentists that turned into nerve. They're studying this trigeminal, like yourself, and he put a low dose of Botox. He wanted to try. What do you think of that?
Well, there are some new studies coming out about Botox and nerve pain, and I have seen some of that. I think the problem we have with treating trigeminal neuralgia with Botox is where to put it.
Right, that's what
that's one of the issues. If we're treating temporomandibular joint problems with Botox, I do have a problem with that, because studies are showing that when you unload the joint, which is what basically you do with Botox, Botox is a chemical that keeps the nerves from firing to make the muscles work. So you're basically trying to make your muscle not work so you can't clench as hard, which should help with pain. And it can do that, but my thing is, why don't we find out the problem first? I never would do Botox on a person I didn't know the health of the jaw joint, because when you unload that joint, the bone can start to break down. So if you're already that person that has bone breakdown, which you have to know from the MRI, Botox is not good.
I'm going to ask him for that MRI.
Do.
Yeah, I am.
It's like if you went to the knee doctor and they just went, oh yeah, you have knee. You'd think, what? You need to find out what's wrong with my knee. Do I have a torn ACL, a torn MCL, torn meniscus? What's wrong with me?
It's an MRI for the joint, you said?
Yes. For the jaw joint.
Okay. Will it show the jaw as well?
It shows part of the jaw. It shows the deep face. It shows the brain. It shows the jaw. It's looking for pathology also.
Okay.
I'll send you the protocol also, Joni.
All right. Thank you.
Melody, did you have your hand up?
Yes, doctor, I was just wondering if you think you have TN from a dental, gone bad situation, and Botox is an option. who would even do something like that?
We don't
'Cause
have
I-
very we don't
I
have
don't
very
know of
many people
anybody.
down here that are doing Botox for TN. I know some of the dentists do it for jaw joint issues. And so I have I think he's a neurologist that'll do it for migraine. And so I sort of just tell him to put it in here, you know, if we're looking for that kind of help. But I don't have anybody really that would do it just for TN here.
Tony or Melody, the doctor I sent you to before Dr. Pepler is doing Botox now. Dr.
Who's?
Bonet. Remember?
Oh, really?
Also,
He
Michigan
is?
Neurology. Michigan Neurology also has pain management, and they do Botox as well. Where do you get yours done, Teresa?
My neurologist does it for me. So he works a lot with patients who have migraine and maybe not and TN together, but those two particular things. And he did it for me. I had it done the first time about a month ago. And
Where did they put it in your face?
Let me think. Like branches. So sorry, I have to do it like that. In here, because that's where I was getting kind of like the most of my pain. And then I think he did also put some down here, but I can't remember.
Okay, so if they're putting it in your masseter muscles, which your masseter muscle attaches on your cheekbone and here,
Mm-hmm.
they're doing the same place that you do it for the TMJ problems. So if that helps sometimes, then I'm going to say that's a TMJ problem, not a TN problem, because it's meant to make the muscle not work. It's not
Mm-hmm.
meant to really treat the nerves.
Well, I've definitely had reduction in shocks and severity since he did it. And I remember like specifically, like you can feel where my nerve is puffy, like you can definitely feel, and that's pretty much where he put it.
But that's also the attachment of the masseter muscle right there. And
Okay.
the attachment of the muscles is the most painful area usually. So I'm not saying you don't have it. I'm just saying you've got some things that would make me look at the jaw joints way more than I would be. I'd be thinking you're touching it too. I'd be already getting your jaw joint MRI and saying, I need to look here first.
I can only touch it now because it's completely numb from another surgery. So if I were to do that before, I don't think I could, but it's been really helpful. But again, you know, I'll have to see like when it wears off in the next like few months, like what I'm really dealing with. But I was also wondering, you don't clean teeth, right? Like oral facial specialists don't clean teeth.
I don't,
No.
you know, and there's so few of us that I think some people do and some people don't. I don't practice general dentistry anymore because I was injured in a car accident. And so I'm a chronic pain patient too, so just not quite the same. But no, I don't here, but I have a general dentist that I work with who does all my dental work for my patients. Did you have a question about cleanings though or anything?
Yeah, I'm terrified to get my teeth cleaned.
Yeah, I know. Yeah, I know, and that's what keeps you away. And then we get this downhill thing of teeth problems. Have they ever numbed the area that's really painful?
I actually haven't had my teeth cleaned since I've been diagnosed with TN because it's only been about a year.
Okay.
So
Well,
not yet, but I'm still very anxious about it.
Definitely something to be anxious about. You know, of course, you want somebody that understands or tries to understand, at least is nice to you. And you know, in most states now, the hygienist can numb you for a cleaning, and because I teach at the hygiene school in Jacksonville also, so they can numb you, so it's not a big deal to get numbed for a cleaning, and sometimes that is extremely helpful because then it doesn't stimulate it. The other thing is to clean everything else besides wherever your trigger area is, so that at least you can get 3/4 done and, you know, leave that for the end. If it's a problem with keeping your mouth open and that's causing the pain, that's a jaw joint problem. So, you know, it depends on what it is is the bothersome. And if you can take something like Valium or use nitrous or something to help calm the, you know, anxiety down a little bit. And there are some dentists who sedate. I don't know whether they do it for cleanings, but they might. And they use Halcyon orally usually, or some of them can even IV sedate you for it. You have to get your teeth cleaned.
point about the childhood trauma thing is so prominent, doctor. It's so well said. Thank you for helping me articulate that to others too.
Yeah, it's the main thing that I see is childhood trauma. Even if they don't remember it, you'll be questioning them and they'll say, "Oh, yeah, I was jumping on the bed one time and fell off and didn't tell my mother because I wasn't supposed to be jumping on the bed," and you're like, yeah. Mm-hmm. And my sister broke her collarbone, which we didn't even realize that she fell on her face, but evidently she did.
Yeah, I didn't get all that history in the note. I tried to be selective, but I could have written a biography on you. Yeah. No, it was all good. It was all good. You got another question, Jim?
He's muted still.
You're muted, Jim.
I was just rearranging my display.
Sorry to pick on you.
Roseanne has a question.
Hi, how are you? It's just so confusing listening to you. You're a wealth of knowledge. And then when you go to the doctors, they're not. And that's the biggest problem we have here.
Yeah.
Even with neurologists, any doctor, I feel like if I'm not asking the exact questions, they're not forthwith with information. Like you're giving so much information and I feel like I'm pulling their teeth to get information out of them. So and that goes for neurologists, certain neurosurgeons, dentists, my dentist, the last time we were on a meet, Lynn had told us about lidocaine, and I went to my dentist for my cleaning, and I said, "Can I have a prescription for lidocaine for my husband?" And he didn't know what he was talking about. He didn't know what I was talking about, and I was trying to explain it, and he said, "Well, when he comes for a cleaning, we'll do this." I said, he's petrified to go for a cleaning.
Sure.
But is there certain questions that we can ask so we know we're going? I mean, and then also going from doctor to doctor to doctor, you're wasting so much time. And I live in Staten Island, New York, and there are orofacial doctors, but I haven't found one that even makes sense to me. Like they don't understand TN at all. My husband has a compression on the TN nerve, but he also fell too and slammed his face. So we don't know we don't know what it's from. Is it from the fall? He did have some little bit of electric shock pains before the fall, but after the fall, it came out full blown. So, and he also had dental work that prior to this fall. So when we go to these doctors, I overwhelm them, and then I get really no answer, and then I'm going from doctor to doctor, and I said, and it wastes time. So
you're absolutely right.
And that's the frustrating part. And then I am petrified to get him a cleaning because, right now he had a balloon compression. He is doing, thank God, okay now. Good. But is there any questions that we can, like an interview, everyone's like, be ready with interview questions, but they're not the questions that are going to get me the kind of answers you're giving.
Right. And that's the problem. And that's why I kind of do what I do, is just try to get information out there as much as possible. So, if it's any kind of a jaw problem, you would hope that they would want to get an MRI. And if not, you would request an MRI if you think that it's any possible one. And I'm always, any kind of trauma makes me think jaw joint problem. So, that's easy enough to rule out, just get the scan, So other than that, the best way to get information, I think, is, the internet, which is difficult, support groups, which are great. My favorite book was Striking Back, and I, it's not in print anymore, which I hate, because I used to give it to every doctor that I talked to in Jacksonville and every patient that I saw that had TN. And so, I keep trying to order them when I see them on eBay or whatever, get here and there, but I used to order them like 20 at a time,
Our dentist isn't even versed on TN,
Right.
I'm explaining what it is. And, and I would say, do you have any patients with it? Even my neurologist, I only use the neurologist to get pain meds for my husband. But even him, he said, yeah, I kind of have like 7 patients, kind of, you know.
Can I interrupt? This is Tony. I live in New York as well.
Hi, Tony.
Hi, I'm sorry to interrupt you, but I do go to a doctor on 5th Avenue, and they specialize, they do know about this. I can give you their name.
Please, I would love it. Thank you.
His name is Dr. Syrup.
Can you spell it?
Syrop.
Oh, I've heard of him.
You have?
Yes.
He's pretty well known, and this is who I'm going to now. They're on 5th Avenue in New York City.
You have their phone number, Tony?
Thank you.
I can email it because it's a 212 phone number.
Thank you.
They're pretty knowledgeable, and I honestly, I thank God I have them because I don't know what I would do, honestly.
Do they do general dentistry also on top of any?
They don't, he doesn't do dental anymore. They're just doing all this like TN and also a lot of different other things, headaches, trigeminal nerve, TMJ. They do everything, but they seem pretty knowledgeable, and it doesn't hurt to speak to them.
No.
I definitely will. Thank you, Tony.
You're welcome.
Send that to me, Tony, and I'll get it to Roseanne.
Okay, I'll send it to you.
Tony, is that Dr. Stephen Syrup?
Yes, it is. Yes,
Okay,
it is.
Let me see if I can grab the phone number here.
He's in 5th Avenue.
Here it is. Oh, here it is. 212-548-3272. Again, it's 212-548-3272. Stephen B. Syrup, Syrop.
That's it. Yes, thank you.
You're welcome.
There's also a really good guy that knows how to do the TMJ diagnosis part. His name is Lou Vida, Dr. Lou Vida. And he's in a study club with me, and he does a lot of diagnosis of jaw joint problems. So he knows to get the MRI. He knows how to read it. And they also do some upper cervical chiropractic work there because we think that's involved in it too. So.
Is he in Florida?
No, in New York.
Oh, in New
York. Yeah.
Know anybody in Michigan?
I do, I think, but I can't think of, I'm thinking Kalamazoo.
Okay.
Maybe. I can look in the study club. I only know the people in the study club really because there's not very many of us that look at jaw joints like this.
Right.
And so, of course, that's why we're trying to get the word out, like anybody can look, and if anybody like has a dentist that wants to talk to me, they can talk. I'll be happy. I'll talk to anybody. I'll talk to people at Walmart, I don't care.
That's great. Thank you. Thank you.
Do you know?
Dr. Dennis, Shaman has a question.
Do you know any doctors in California? And then 2, do you find it compounding? For example, like I feel like I have TN1, TN2, damage to the TMJ joint, hemifacial spasms, cluster headaches.
Yeah. All come from your jaw joint.
Yes, ma'am.
And so you have that block. And then whatever that block takes away of your pain is from the jaw joint.
You said blocks? If any blocks work?
That the specific auricular temporal block.
Okay. And
That's
if
how
that
we
one
know what it's called. Like even if you have a concussion, if that blocks that pain, it's from the jaw joint.
Okay.
And I don't have anybody in California. Sorry.
Yes, ma'am. Sorry. Like then would the treatment plan maybe be like strike your back possibly, or is it hard to say the treatment
plan?
Well,
if the jaw joints are damaged, just like a knee, you have to repair them.
Yeah. Okay. Okay.
Yes, I would look into a local hospital, like a dental school associated with a hospital. You'll find somebody there.
Sometimes people have to just find anybody that'll order the MRI. I talk to people online, and sometimes it's their ENT, their primary care. anybody to order it just to get it done, because it's a very controversial subject about can the jaw joint cause this kind of pain, but it's 100% true. There's no reason why it wouldn't be true because of that branch of that nerve. There's just no reason for it.
Other questions for Dr. Dennis?
I think Roseanne was talking about, or somebody was talking about pain in the inside the mouth or the teeth. Was somebody talking about, or lidocaine, maybe you're talking about, if, for a lot of the people that have teeth or gum pain, we can make a cream that goes in a little shim that sits against your teeth to hold that cream in there. And that's really fairly helpful for people with inside the mouth pain. And we can, it's a compounding pharmacist that makes it, and we can put anything we want in it. Basically, we usually use ketamine's the big thing that helps. Ketamine and lidocaine, and sometimes we'll put some of the anti-inflammatories or anti-seizure medicines in it, and then you can have a little plastic shim made of your teeth to hold it against the teeth and the gums, and that actually can be really helpful for intraoral TN pain.
How long would you leave that in?
You can leave it in all the time.
Really? Wow.
Mm-hmm. And I've had some people say, which doesn't really make a lot of sense, but it's okay, that the pressure, even though it's very, very little pressure, actually makes them feel better, which I think would be the opposite, but I don't care. As long as they're feeling better, I don't care why they're feeling better. And sometimes just the covering of the teeth also makes them feel better.
Have you ever heard of the ketorolac for ear pain? You use the ophthalmic drops, but you use it in your ear. It's amazing. It's so good. It's amazing.
I mean, they make Voltaren for your skin, so it's basically the same thing.
It's really helpful.
That's great.
I didn't associate that with.
Well, the other day I had a patient too that has TN in their nose from a deviated septum surgery, and we made up the pharmacist got me lidocaine in a spray bottle, like a neosynephrine bottle, so it goes up, not a pump, and it goes up in there, and that's really been helpful. That's really helpful. And the pharmacist said that he could use it as much as he wanted. He can't hurt himself with it, so that's been great.
Melanie, did you have a question?
Well, I was wondering on those plates, who do you go to for that?
For the shim?
Yeah, the plate where they put in, and you stick, you've got all that in there. You said, and you can wear all the time.
The dentist would make the trays, and they're like bleaching trays.
The tray, yeah.
Yeah, the dentist would make that. And then
my dentist, I don't think would even know.
Yeah, you just ask for bleaching trays, basically.
Oh.
Yeah, and they're just like bleaching trays or medication stent. They can look it up on Google. Medication stent. It's just take an impression of your teeth, and they have the lab make it. It's super easy. And then whoever writes your meds would write the compound to put in there, in the cream in the shim.
The thing is, my dentist knows I have TN, and he's never said, oh, we can, help you out with that or whatever.
Yeah.
No.
Yeah.
Yeah. Would you need to go to a dentist who specializes in, No,
you can, if you'll just ask them for a medication, if you'll whatever, PM me or whatever, I'll send you the picture, or you can Google it even. I think I pulled the picture off Google actually. I'll send you the picture of it. It's just a clear shim, and all they have to do is take impressions and make the shim for you. They don't have to do anything else. So they'll do that because they'll charge you for it.
yeah, right.
They'll do it. They don't have anything in it, so it's not like treating you. So
yeah.
But that's a really good way to do inside the mouth pain. I use that quite a bit. Yes, Roseanne.
What do you put in the tray again?
Well, I have a list of things that I put in there, and the biggest one is ketamine, because ketamine works really well for pain, but you can't take it very much. So ketamine, lidocaine. Sometimes I put anti-inflammatory. Sometimes I put anti-seizures. Sometimes we'll put, if people like that menthol, we'll put that in there. You can put morphine in it. You can put anything in it, basically, anything you want. And so You just give the compounding pharmacist the prescription, which I can send to anybody too, and
Send me that,
right out.
and I'll get it to Melody. Yeah.
Okay.
Dr. Dennis
Thank-
Roseanne has a question.
Yes. Roseanne,
She's coming. She's got on mute.
you're on mute.
Sorry, yeah. I
Okay.
was reading the question because whoever just wrote that question, how about raising awareness to dentists. How come dentists are not aware? Like I just, it boggles my mind.
Boggles my mind too. The only thing that we can think of is that, you know, they're taking all their time to teach us how to not kill people, you know, with the stuff we do. And I mean, I think they could have put more into it in dental school, but we were pretty busy learning what we did learn. And so all I can think of is that there's just not enough people to make it that we have to learn about it. You know, every dentist I know says they learned anything they learned about it after dental school. I mean, I can't even honestly remember learning about it in dental school. I'm sure we did, but you know, that's how little that they were taught. And that makes me crazy too. I teach all my hygiene students about it, no matter what I'm teaching. I teach dental anatomy, oral pathology and dental materials. And no matter what I'm teaching, we talk about jaw joints and TN. So, you know, my hygienists in Jacksonville know about TN. You know, there's probably, I've been there 8 years and we get a 20 a year. So I've got 150 hygienists in Jacksonville who know about TN. So, you know, making my way through, so trying to get everybody.
But see, we're fortunate that you and your sister had those problems and led you to it.
Yeah.
And TN is such a rare condition as it is, even for doctors, let alone dentists. We had a big push here, Lynn knows, trying to teach the dental community in the Detroit area. And in fact, we had a big presentation to him. My son happened to get married on the same day in Atlanta. So I had a 10-minute video and Lynn took over with the local neurosurgeon and pain specialist. And they said it was quite successful. Like I say, I was in Atlanta. But
I try to go, you know, I mean, I'll go to anybody's office and talk to them and tell them, you know, about it. And then I used to give the book out. So, you know, I mean, I think that's great to try and make the dentist aware, because the usual one of the first symptoms is teeth pain. And, you know, every person that has TN has the story about having the teeth extracted or the root canals or the, you know, and so, you know, now my patients aren't allowed to have any root canals until they talk to me. You know, they're not allowed to have any teeth extracted till they talk to me.
Well, Laura's dad, Dr. Casey, told us about 5-7 years ago that of the total population in the TNA or FPA database, 62% of the people at one time went to a dentist first.
I agree.
It felt like a bad tooth. Yeah.
Luckily, I guess in Jacksonville, I mean, not everybody, but I do get referrals that way, you know, that we don't see anything wrong and this person swears it's their teeth. And so that's good. I mean, you know, I wish I could get to more people. I wish I could get to everybody, you know, but this is, you know, I give it my best shot. So
Yeah, there's Lynn.
Dennis should know. They should know.
Lynn's trying to make us all feel better.
That is a cute baby.
She's got her teal collar on for TN. It's raining out there, so I had to run her out. She's still little.
She's so cute.
She just wants to eat us. That's all she wants to do.
She's growing fast.
Yeah, she is. She's liking all the people.
She's got such an adorable face.
Thank you. It does help to have a puppy or a kitty or fish, whatever you got.
I have a Great Pyrenees that I bring to my office.
Oh, wow.
He has an affinity for pain patients. If you're in pain, he is stuck to you like glue. I had a 15-year-old girl in the other day, and for 2 hours, she sat there with her arms around his neck, and he did not move a muscle for 2 hours. And I said, you know, honey, I can make him leave if you don't want him around you, because he won't leave. And she said, no, please don't.
Look at her watching you. She's really watching you, Dr. Dennis. Paying attention.
Animals like me, yes.
Oh, that's cute.
So do we. So do we, Doc.
Yes, absolutely.
You know, anybody that has a question or anything, you're welcome to contact me. I may not know the answer, but I mean, I certainly would try to help, you know.
Well, let's blow out she's Peggy Lou 61 at Comcast.net, right?
And we have a Facebook page that's TMJ NTN dash the Orofacial Pain Center. I have to think what it is.
Perfect.
And then my personal messenger is just Peggy Dennis.
Perfect. Thank you so much, Dr. Dennis. You were
Thank you.
Dr. Dennis,
Thank you so much.
Barb doesn't have a microphone tonight.
What was your Facebook page again? TM.
TMJ and TN dash the Orofacial Pain Center.
Before you go, Dr. Dennis, Barb
Oh,
wanted
I'm
to
good. I don't have to go. I'm good.
No. I think the questions are done, but she wanted to show the FPA has a focus this year to target dentists to educate them about TN.
Perfect. That's great.
Yeah, she doesn't have a microphone tonight.
Who did?
Barb Blank. Barb.
Oh, okay, Barb in the corner. Yeah.
Yeah, that's great. I mean, I'm pretty sure it's like because it's not AIDS or cancer or something that it doesn't get the, you know, exposure that it should. But I think that dentists should know more about it.
Mm-hmm. Mm-hmm.
Barb, when you weren't off, I said that you had contacted me last week and said, oh, you got to get this Dr. Dennis online. And I said, guess what? She's speaking this month.
That's awesome. That's awesome.
Yeah.
So
what else did she want to do, Pete?
That's it. She just wanted to underline that FPA has a focus on dentists trying to learn more about TN. So
Sure.
there is a formal push for it.
Good.
Okay.
Great.
Anybody else? Any questions? Or we can open it up and you're welcome to stay for, oh yeah, we've got other things. Tim will wake up here in a minute.
Well, I'm going to say goodbye then, but
Thank
please
you,
let somebody
doctor.
contact me if
Bye.
you
Thank
need
you.
anything,
Doctor,
okay?
you're a saint.
Thank you.
You're a saint,
All right.
doctor. Love meeting you, doctor.
Nice to meet all you guys.
Thanks,
I
Tim.
can figure out
Thank
out
you.
here.
Thank you.
Thank you.
Katie? Yeah, she's gonna, Katie, and I was gonna explain more in the note why you would be talking, but then I thought I'd leave it up to you. But just quickly, this relates to having Dr. Ord Sager with us from University of Michigan last month. For those people that weren't online last month, we followed up with him, and I'll let you take it from there, Katie, on why don't you give a little history on how well that networking worked?
Well, it was just so life-changing, really, because I credit this group and Tim especially that you were willing to reach out and see if he could help clarify the question about my MRI. And without going into too much detail, I'm happy to share my email address if anybody wants to send a question more, because I've been in this discernment process about if MVD is right for me. And so I had been on a path to go forward with a surgeon in Detroit, and then in our meeting, I had shared a question about whether or not the indications on my MRI were sufficient to lead Dr. Sager to also come to that conclusion, and he shared that he wasn't so sure if MVD was the right next step for me. So he was kind enough to make a space in his schedule to talk with me further about it. And what I learned in that conversation was he scheduled me for a consult. So in addition to just having the little blip about my MRI that happened in this meeting at support group, he heard my whole story. And I think the fact that I was able to clearly describe my history, and he said, yes, it sounds like you're very clearly in the classical diagnosis. I'm going to use that to weigh a little bit differently on what I said at the meeting. He modified it just a bit to say, I do think that MVD is a reasonable next step for you to take. I would also want to make sure that you have clear expectations about it, given what we see in your MRI. And so I am still going to go forward with it. And the really surprising thing that occurred was I learned that not only does he practice in Ann Arbor, but he practices once a month in the Grand Rapids area, which is where I live. So I'm in West Michigan, and I didn't think there was really any chance I would get in to see him in Ann Arbor for a very long time, but this other news came forward. So I am scheduled in July to have MVD with him. And I feel like the important thing, there's two important things to share. That he's available in West Michigan once a month. He shared with me the name of the group in West Michigan who also would be taking trigeminal neuralgia patients. And I'll type into the chat the name of the physician that he named over here in case you live in West Michigan and need that information. And the other thing that I thought was so helpful was I think that both he and the other surgeon were looking at the same MRI, and they were each thinking about it a little bit differently. And I think it's a function of the fact that it used to be quite clear sort of philosophy around discerning MVD that you didn't let the MRI be too strong of a determiner of if it was right or not. It was one piece of a puzzle. And some surgeons will look at it and say, even if I don't see any compression on your MRI, I still feel strongly that we will have a successful result with this because I may find something during that surgical procedure that I don't see on the MRI. And Dr. Sager's experiences, our MRIs now are so good. They didn't used to be so good, but they're so good now that in 99.9% of the cases, if we don't see it on MRI, we're probably not going to see it when we go in there. And I think many of you who were at that meeting heard him say, if it's not on the MRI, it ain't going to be there. So we're in this place where there's a little bit of a shift in the way that different surgeons are treating the information that comes from MRI. And he essentially let me know, I've kind of got the burden of two good choices. I can either go forward with MVD, knowing that it has sort of a limited possibility for success in my situation, or I could do something like radiofrequency or one of the other ablative procedures. And he was comfortable offering either one of those as an option, or neither one. But those felt like pretty big learnings for me since that last meeting. So I wanted to say a big thank you, and certainly open to any questions from people who want to just message me directly.
Let me just add a couple things, Katie.
Sure.
One, he reviewed your film online. You sent your film to him, and he looked at it even before the consult. The second thing was, as I remember, it was where the compression is relative to the brainstem. In other words, how far it is, and correct me if I'm wrong here, Kate. It depends on where the compression is as it exits the brain, as I remember it. Right?
Yes, Tim, you are absolutely right. And in my case, I don't actually even have a compression. I have what is described as mild contact.
Oh, that's
So
right.
in my case, mild contact is occurring farther out from the brainstem, not close into what he called the armpit of the brainstem. So
Close in is more indicative of a MVD.
Close in, yes. Close in is more indicative, and certainly compression is more indicative than contact.
But you have the clinical symptoms of classic TN.
I do.
And you have no constant pain.
Correct.
It's all clinical. Just a couple other points. He sees 5 to 10, as I remember, TN patients each week it was, right? Not month. Because a lot of neuros don't see that many.
I don't know how many he sees in Ann Arbor, but I do think in our meeting he told us that is the frequency of TN patients that he sees overall.
Right.
In West Michigan, of course, he's only coming once a month. So
yeah,
I'm sure it's less than that.
And the last point, and then let him go to questions, is the issue of if you have the MVD like Mary Ellen did, and we talked in January, and then her neuro in February, you can always go to the rhizotomy if the MVD doesn't work, or if you have it in 5 years post MVD, the rhizotomy worked excellent for Mary Ellen. So I didn't realize that he was possibly suggesting a rhizotomy prior to an MVD. Sounds like that's what you said. He would give you that option.
I don't know that he said prior to. I think he said
I don't think that would make sense because of the scar tissue.
Right. Right.
Yeah, I think that he was saying I could choose either one of these options
Okay.
as reasonable steps to take in my circumstance.
Yeah, rather than you choosing, I would hope the doctor would lean one way or the other. Did he lean to an MVD?
You know, he walked me through my MRI with me right in the consult. He walked me through it very carefully and said, this is exactly what I would be looking for. And I am not seeing those things that would indicate a very clear outcome for you.
Okay.
So I really appreciate his candor. And he said, you know, obviously, if I thought this was not going to be at all successful, I would not tell you that I'm willing to do it.
And Lynn, you can address the issue of the MVD. It's indicative. It will only remove the shocks. It won't remove any constant pain, which you don't have anyway. And Lynn's an example of that. Yeah.
I love how neurosurgeons make sure you understand the expectations. But like I told Katie privately, that just resetting my basic pain meds and all that really helped my being able to cope with the pain. That I think having the surgery and then I didn't need as many meds and I was able to titrate down. That in itself was huge. It didn't take away the burning, but it did really help. So
it shocks from your eye, right?
It did take away the shocks. So yeah. So that did help.
That's so helpful that you've added that, Lynn, because I feel like that is really strongly factoring into my decision to go forward. Because I have had
so many meds, right? It's so weird.
And
it's a quality of life at that point.
And she's working yet too, so that's more important.
Yeah, I've had actually it took a while, but I've had excellent pain management on this high level of Tegretol, but because of that, my side effects are so strong, I haven't been able to work. So again, it's
and that in itself just it messes with your self-esteem and all that stuff. If you know. We all go through it, and you're so gracious in letting us walk with you on that, Katie.
I just can't say enough. And Tim, I never would have had my MRI looked at by Dr. Sager in that brief period of time had it not been for you and the relationship that you two have cultivated with him. He has such respect for this group. And
that goes back to Maria Martinezzi, a friend of hers, reminded me about Sager 15 years back, and when I called him, he talked like he was my neighbor. I mean, he's that kind of doc. You don't. I mean, not all neurosurgeons are born that way.
Right.
I mean, they all have their own quirks. He ain't got many, and he's just like the guy next door. I couldn't believe it. Oh, Tim, how you doing? God, I haven't talked to you in a few years.
Yeah.
2 years was like 15. But
it's like family.
It was like Maria. Maria brought him to my attention. I had never thought of him again because he's out in Ann Arbor. But now
we knew about him from. Yeah, we knew about him from that other case.
Yeah,
Brown helped us with that. Dr. Sager went in and fixed that with the bat.
Oh, that's right.
Yeah, so he was fabulous. He was so instrumental in that.
Lynn, you're closer to that. Off for a minute. Would
private
Dennis?
Would
Dr. Dennis issue help Angie at all now?
I don't know.
You're referring to?
Yeah.
She have a jaw issue?
I would keep it HIPAA private for that.
No, I'm just saying to you, think about that. I'm not asking you to define it. Just think about that. We'll talk.
Yeah. Well, anyway, I think he would also coach if others are trying to get in to see him and traveling is not an issue. I think getting in to see him in his West Michigan office is probably easier to do than getting into a consult, if time is a factor, than getting in Ann Arbor.
Good point.
So, thanks for this option.
And when you get better, we're going to have you start a group in West Michigan.
Well, there is a group in West Michigan. You know that, Katie, right? It's Kevin, wasn't it Kevin?
Well, there was one that died off.
It's a bad word.
Yeah.
He didn't die off. He's just a young guy.
No, the group died. The group died
Yeah.
off.
Yeah, okay.
Well, maybe you can help us get connected. I would love to speak to anybody over on this side of the state who's
Yeah.
trying to bring people together, for sure.
Mary Ingalls is also mid-Michigan, up kind of by Grand Rapids, up in that area.
Who?
Okay.
Mary Ingalls. I believe if you look at the facial pain support groups in Michigan, you'll be able to pull her up.
Okay.
Yeah.
Well, I'm pretty attached to you guys now. I'm afraid you're stuck with me, but I'm glad to know there are others that are.
Fabulous. Well, we can't wait to hear the good results.
Okay. Thank you.
Yeah, yeah, because we don't meet, by the way. I forgot to put that in the note. We don't meet in the summer, folks, in July and August. In September, we're hoping to get Dr. Guthakonda. He hadn't responded to me yet, Lynn. And then my new pain specialist, Melody, you're on. Dr. Mark Monnier is going to speak in November.
Oh.
And then we but your appointment's before that, right?
Yeah.
Yeah. And Jerry I just sent her name, Jerry, to him, and they're going to give her a call.
Okay.
On Dr. Pepler, I don't know if anybody else is a patient here other than Melody. Jerry advised that he did the virtual from home, and he'll probably work through July, Melody. I don't know if you'd heard the same. It sounded, this is our doctor who came down, was diagnosed at Michigan with ALS, of all things, God help.
Yeah, he's not working long. No.
Yeah.
No. He said it's progressed.
But he's got somebody to take over though, so I don't
know. Yes, he does.
Yeah. But well, anyway, separate issue. We're open, folks. Lynn Bailey from New Zealand wrote me yesterday, and Lynn and I, and said that she's at work today. So I'm sorry, the other side of the earth is not with us today. But, you know, if Pete's willing to put up with it, me especially, he's got to put up with Lynn, although she locks him in the basement.
This is going sideways. What happened here?
As long as Pete will put up with us, me, God love Pete. I'd kiss him if you were my neighbor. Yeah, it's serious. You know, guys, we wouldn't be meeting if it wasn't for Peter Rupi.
Yeah.
Oh, come on, guys.
Seriously. I don't know that we'll go back to that Beaumont conference room. You want to drive across town 45 minutes one way?
No.
No.
That's a hard
This is so easy.
That's probably why he's so good to me.
It was always such terrible weather. I don't think we met. Yeah.
We would get Detroit's worst weather on those nights.
You didn't miss many meetings either, Lynn.
No.
Well, she drove herself for a long time. Then Peter, was that an edict, Pete, that you had to drive her?
No, I retired, so I had time. It was
I get it.
Hey, Tim Roseanne has a question. When you get a chance, we don't want to interrupt what you're talking about, but
I blab it. Yeah.
I was just going to say I'll miss everybody in the summer, but can we still contact each other if we have questions or in the summer, or is it everybody needs that vacation?
Nope, absolutely. We're here for you.
Our numbers, our phone numbers, and our emails are at the bottom of the page. Lynn, as you know, is the one that's got the nursing and the dental background, and I got the bullshit. So if I can help you with that, I'll help you out.
Thank you.
Yeah, we got a tough case in Georgia now that Lynn and I have been working after.
And I'd love to hear how Katie's doing after her surgery.
Yeah.
We got to put up
Thanks.
We should have a special meeting in mid-July. Well, yeah, it'd have to be later in July. I'm up at the lake in mid-July, but.
Well, what is Katie going to do?
MVD.
For sure?
Yeah.
For sure. Yep.
Okay.
July 8th. I'm all
We're
on.
praying for
Pray
you.
for you.
Thank
What'd
you
do?
so
Fall
much.
asleep, Melody? You fall asleep, Melody? I got to pick on her. She's my good friend.
You've done your due
Well,
diligence.
I was a
Katie.
little confused because there was so much of, what it was, between the different options. And I thought that's what she said. Just wanted to confirm it.
What you mean is I confused you. I understand.
No. I confused myself.
Okay. Yeah, we talked about going to quarterly meetings. I don't know. Back to what Roseanne is saying, I think we've got enough people that we probably should still meet if Pete's up to it. Meet bi-monthly. Way back, we had 10 speakers a year. We had them from January to through the end of the year. It skipped summer, but then it got to be a little redundant. And so I think maybe we ought to stick with the bi-monthly. We've got so many things going on, and Roseanne's got her husband, and I haven't heard from Robert. I'll be damned if I can say his name.
And Roseanne has another question when you get a chance, Tim.
Who does?
Roseanne has another question.
I have a lot of questions tonight. I just didn't get Dr. Peggy's email. I heard Peggy something at Comcast.com.
Peggy Lou.
Peggy Lou.
Lou
61 at Comcast.net.
Peggy Lou 61 at Comcast.net. Thank you.
I graduated from high school in 61. God knows that
You
wasn't.
posted it too.
That must be her year she got her degree or had her car accident. I don't know. She shared all kinds of information with me. And I didn't want to blow her sister's cover, but hey, Robert, picking on you there. Steve Benetto.
Oh, he's got a.
Way back, Bob, when we met at the Beaumont conference room, we had the first item on the agenda, I guess right after the speaker, new member introductions. And we probably should go back to that to at least give everybody a chance to speak up and talk about their case. Do you want to share anything with your history? And Lynn or I could jump in, or anybody can jump in and provide any answers.
Sure. I basically had acoustic neuroma, which, best guess, it blew up after the radiation that I went through, the cyberknife, and possibly ripped the sheeting off the trigeminal nerve. So I don't have the shooting pain, but I have just constant pain.
Oh, God.
Pretty much, it varies day to day, hour to hour, depending. By nighttime, it's usually all three branches. During the day, it's usually first branch, third branch, or however they go. And I was more interested in what Peggy had to say about the tray, because my main problem is with the teeth. I get most of my pain in the teeth, in the gums. It's more like a burning, annoying. It's just burning and annoying.
Where are you, Bob? Where are you located?
Right now, I'm up in Ossining.
Is that Michigan?
Yes.
I got the doctor for you.
Okay.
Yeah.
And yeah, because I'm up here 6 months out of the year, the other half I'm down in Florida.
Where is that? Where is that? In the UP?
No, we're just south of Alpena.
Got it.
Where Traverse City is, we're across on Michigan.
72.
Where Alpena is up on the Huron side.
72. You're by Hubbard Lake.
That's correct. Yeah, I go fishing there.
Yeah, Go had a place there. Then I'm going to put out a note, and I won't put your name on it if you don't want it. I got to tell all our members, do not get a damn cyber knife. See, that's the lady in Kalamazoo, the same damn.
He had acoustic neuroma.
Yeah, but he had cyber knife. Well, what caused the pain, the cyber knife or the neuroma?
I think it was a combination of both. I think the cyber knife did a good job on the tumor itself. but about 30% of them expand after they kind of just mine, tripled in size.
Yeah.
And before the decadron and everything else, and it kind of just came back, and now it's smaller than it ever was.
Where'd you have it done?
That was the University, Tampa General.
Oh, in Florida.
Yeah, with USF.
I understand they got signs all over the highway down there recommending CyberKnife, although I didn't see any when we were there, but I was told they're pushing CyberKnife in Florida.
Yeah, in my case, the tumor was very small, and it seemed like a better option than them going in and cutting it out.
Did anybody have a Gamma knife, Bob?
No, the Gamma knife is up in, I think there's one up in the Orlando area.
Yeah. But I need you. I can't promise you, but I have a new pain specialist that's dealing with. Has anybody said you have TN now?
Well, they say I got everything under the sun.
Well, the new process with this new doctor is I send him your name, the phone number you want to be called on, and his scheduler will set you up, except he's down here in Troy, Michigan. He's not up in Alpena.
Which is fine. From everything up here is like I tell the wife, if you have a heart attack, they don't send the ambulance, they just send the hearse.
Yeah, no, I know it.
Yeah, because it's if you make it to mid-Michigan, all they do up here is triage, and then they send you someplace else. So,
but they've got a Gamma knife in Midland.
Okay.
Yeah, that's beyond. Forget that now. But if you want to see a pain specialist,
yeah, I'm trying to. I would love that actually, because I'm trying to get. I'm up here 6 months plus out of the year now, so
yeah,
I need a medical support group up in the Michigan area. They put a shunt in, which is.
You're breaking up.
Yeah, they put a shunt in to drain some brain fluid because it was backing up because of acoustic neuroma does that. And as a result, anytime I need an MRI, I got to find a neurosurgeon to adjust the damn thing. Regardless of what the MRI is for, it could be for my ankle.
Yeah.
It needs to be fixed.
Well, your best place to go to that, I would think, is Midland. They're associated with University of Michigan now. Mid-Michigan.
Yeah, I called down there and they couldn't find anybody that would.
Yeah.
They were.
Yeah.
Nobody just wants to see somebody with a shunt. Let's put it that way.
My contact for TN retired, so. But let's talk offline.
Okay, you have my phone number?
No, but we'll talk offline and you can give it to. Well, okay, give it to me.
Yeah, 239.
Yeah.
734.
Yeah.
5204.
But we need to talk offline yet about what this doctor is and what the alternative might be. Just 5 minutes. I'll call you later tonight.
Okay, because I'd love to get his name and go see him and all that good stuff. Like I said, just trying to get my support, my medical support people in place up here too. I'm up here quite a bit.
He'll call you.
Okay.
But you have a general dentist in Michigan, right?
Not yet.
No. Okay.
I'm still working on that too.
Yeah, because you can get that plate made and then try any of those compounded pain medications.
Yeah, we need the physician to actually do the compounding, I guess. Put in the order.
Where is the neuroma, Lynn? Do you understand that?
Yeah, it was near your hearing, correct?
Yeah, correct.
Hearing and balance, yeah.
But you get the same, instead of TN1, I guess I got TN2, which is I have the constant.
Yeah.
It's not where it's more feels like something's just sitting on the nerve permanently and just kind of
When
compressing
did
it.
you have that done, Bob?
Oh,
When did you have the?
6 years ago?
Oh,
6 years ago.
Check.
Have you noticed it changing at all?
It waxes and wanes. It's like the weather; it changes all the time.
Right, right.
Sometimes I feel like it's getting better. Other times I feel like it's getting worse. But I think the neurologist I go to is kind of like like a day's going, kind of just getting used to it.
Does heat or ice help it out at all?
Hmm?
Does
Excuse
heat
me?
or ice help?
It doesn't. Ice doesn't help. Heat doesn't help. I haven't really found anything that does help.
What pain level, Bob? 0 to 10 on average, and at its worst?
Probably, at its worst, probably 6, maybe a 7.
Yeah.
But usually I'm getting like it's probably a 6 to somebody else, but I'm so used to it now. It's probably like a 3.
Yeah.
3 to 5, and then usually about this time of day. It usually peaks about 3 o'clock, and gets really squirrely at that, and then it kind of subsides again. It kind of, like you said, it'll go up to 6, go back to 3. Yeah.
Sorry, you're going through all that.
Yeah, we had a psychologist who specialized in pain, and he told us about 15 years ago, when the pain resides in, on average, the 5 to 7 range on a fairly consistent basis, that's the time to consider opiates for being able to live a somewhat comfortable life. So that's old. I don't know what he would say today. I've got an old video of him. I threatened to get Pete to put up line, but it could be old by now. So, right, Pete.
And supposedly opioids supposedly don't really work too good on this type of pain.
Yeah, who told you that?
Everything I've read.
Yeah, well,
and even most of the gabapentin, the oxycarbazine, the triptyl, and
those, Bob, those are made for the shocks. Anticonvulsants are made for the shocks.
Yeah, I know.
Pain meds are made for the constant pain.
Yeah. And
What
then,
about an antidepressant for the burning?
they kind of rotated me on a couple different ones, or right now we're just on the oxycarbazine and gabapentin.
Oxy what? Carbamazepine?
That's correct. Yes.
I thought you said Oxycontin.
No, oxycarbazine.
Yeah. Okay, we'll talk later, Robert.
Okay,
Unless you go to bed early.
No, that's fine. And then, like I said, I was kind of interested in Trey, and I've heard some pretty good things about that ketamine.
Yeah.
Which is, it's virtually a horse tranquilizer. But
had you heard of that, Lynn? Yeah, horse. Had you heard of that?
Yeah, that's what.
In the tray or the injection.
Yeah.
I know, but he does injections, right? Casey
does. They use it in surgery and all that other good stuff too.
Yeah. I hadn't heard it in a tray, Lynn. Had you, with your dental background?
Yeah.
Okay. I think I'm making your headache worse, Lynn.
No.
Okay, look forward to talking to you later. Thank you.
All right. Take care.
Vanessa, do you have any questions from California? She's muted. Maybe she didn't want to talk. I saw her online, so I'd say hello. She and I talk quite a bit. Anyway, I won't put her on the spot. Which I already did. Sorry. I won't do what I already did.
Right? Time, Tim.
No worries.
I better give up. She won't talk to me anymore.
I don't know about that.
The last things are.
We love you, Tim.
Absolutely.
Yeah, right.
We do.
I'll get offline, Melody, and see if you say the same thing. we do, Lynn knows more about this than I do because I don't go on Facebook or the FPA site. But we do recommend, there's a lot of pain. Oh, did you get my note tonight to FPA, Lynn? About them setting up those damn taped webinars the same night as our meeting? My wife said, were you pissed or what? I said, I brought that up to Reggie. Well, I better shut up.
Well, why do they have to do that? It's frustrating.
Yeah, I know. Well, at least I didn't put you on the note. I didn't want to even, I blind copied you. I didn't even want you to be, let my shadow overshadow you.
We just got the email. I just got the email now that it was going to be. So they didn't even like let us know that it was going to be tonight.
And it's
work.
so what difference does it make? It doesn't make any difference.
Yeah.
You can't ask questions. So who cares?
But I told them months ago when they were doing that.
Yeah.
We've had this time for 25 years. Anyway, I wrote a friendly note today. The key is though that Pete's got up to now over 40 videos online. So if you want to go back and see some, probably the ones, Lynn, you'd recommend the most would be Dr. Casey. And he's such a, oh God, whoever, you know, and it sounded like Laura didn't know who gave him the liver.
They don't know yet.
She doesn't know.
Yeah, they don't know yet.
Would it have to be female or male? No. Could be anybody, right? As long as they were alive.
It was the same blood type and the same.
Yeah. Oh, blood type.
A certain age, but yeah.
Thank God.
Yeah.
God. We're gonna check out before they.
He was circling the drain, man. That was scary. Oh.
Yeah.
Thank goodness.
What was that comment? Circling the drain? I hadn't heard that one. Is that a momism?
No, that was my orthopedic surgeon said that he was circling the drain too, and I told him about Dr. Casey because he was in the area too, and he just held his head in his hand, and he was so empathetic about.
Had to be under 55. You had to have O blood type.
Yeah.
Something else. Yeah.
Yeah.
They had somebody, and well, I better not. We're taping.
Yeah.
Anyway,
that's self-control. Yes.
I don't want to have Pete go back and edit it. He has it already. You can tell I had 4 hours sleep last night. So, and Seamus and Vanessa. I wish I could get out to California to see my relatives in La Mirada. We were invited to a wedding on the Stanford campus, and my wife bailed at the last minute. I was going to drive down 1A1 and stop and see you guys, but she voted me out. Anyway, well, we drove to Florida and back. My wife said, "Never again." She said that. She said that 3 years in a row. She forgets so. Good when your memory goes, I'll tell you. I told her I'd fly her down. I'd pick her up in Orlando next time. But by the way, I do have a timeshare in Cabo San Lucas, Mexico. If anybody for a fairly reasonable, well, somewhat reasonable maintenance fee, I can put you on the beach in Cabo, and you might even talk me into paying some of it myself. But Roseanne, if you need to take
when do you have it, Tim?
You're reading my mind, Tim.
Yeah, I've only had it 20 years. I think I bought it in 01 or 02. We haven't gone we got home in March, in the start of March 19, I think. And we were the only ones on the plane, I think, that had a mask. Well, 3 Chinese people at the back of the plane that got off first had masks on. But that's about the start of the pandemic. And nothing against Chinese, but since they brought us the, as Trump says, the Wuhan.
The Wuhan.
Sorry, I brought his name up.
How do you do on planes? I'm nervous. I didn't book a vacation. I'm a teacher, so of course summer is my time, and I didn't book a vacation because I'm so afraid of Joe, of the pressure
Lynn, what about you? See, I had atypical. It never bothered mine.
Yeah,
Did it bother you, Lynn?
It doesn't bother me.
no, okay, because I'm hesitant. I want this balloon compression to last as long as it can.
Yeah.
Yeah.
With heavy
So,
Yeah.
so Tim, when's your timeshares available? Like,
365 days a year.
oh yeah, anytime?
Yeah.
Oh,
I
yeah, I
have-
might take you up on that.
Anytime. I've got a winter studio, a winter 1 bedroom, a winter studio, and a summer 1 bedroom. Depends on the season. But you can even use the summer 1 bedroom if you pay the upgrade. But it's better just to take one of the, if you're going in the winter, take the studio and the studio is big. The 1 bedroom's nicer. I think they can only up it 3% a year. We're right on the best beach, Medano Beach, within a mile walking distance of downtown Cabo. And I can tell you of all the casinos and dance places in Cabo.
Sand fleas?
No, and well, Donna gets no-see-ums in Florida, like she was a no-see-um herself, you know.
Okay.
But she hasn't had any. The only time she goes to the beach is all the jewelers know her name, and she brings, you know, it's like the 16 kimonos she brought back from Japan. She brings all these gifts, bracelets, and everything for rings for. The jewelers know her, but she's never gotten them there, Lynn. But she spends most of the time at the pool, which there's not much sand near the pool. So
Yeah.
yeah, those are bad.
So it's really nice. So the 1 bedroom is the one to go with, right? And
I think
that sounds good.
I have to go through interval when I give it to somebody else, unless you're one of my kids. And I think with the interval fee, it might run $1,000 for 7 days.
Oh, gee, that's really good.
Well, yeah, it's a 4 or 5 star resort right on the beach. Mild from you can get way up the fancy ones up on the highway. Well, they built
Tim,
a new one.
Send me the info. Send me the info. Is there anything you can send?
Yeah, it's online.
All right.
If I forget tonight, let me know.
All right.
Roseanne, I just posted a quick note to you about airplanes. I've had a lot of trouble with ear pain flying. My ears will plug up. I can't hear for a month after flying. And
I have the same problem, Pete.
yeah, so I've tried Sudafed nasal sprays, but those work. But the airplanes, I went to California 3 times last year, had no issues whatsoever. I don't know if that relates to TN, but
yeah,
those things were magic.
Yeah, that nasal stuff. And what else did you use?
No, earplanes. It's some kind of a earplug you put in that.
Oh, yeah.
And I haven't gone without it, so maybe it's a placebo. But you put them in an hour as you go into flight, and an hour before you land, and I had nothing, and it was like night and day.
Where'd you get them, Pete?
You get them on Amazon. You get them at a drugstore. They're
just earplugs.
It regulates the pressure. It's specifically
right.
flying.
Earplanes, you called it, right?
Earplanes, yeah.
Earplanes.
Donna had a lot of her ears. They used to wrap her in a blanket as a kid and lance her eardrum. So
I've had
ear pain. Yeah.
Yeah, I've had my ears plugged up. I've had to have my eardrums lanced many times. So
I've had that plugging though, where it can be very, very painful. Very painful.
Yeah, it's not painful. I just can't hear. It just doesn't. My tubes are too small.
They're painful.
I never grew up, but
yeah, you did.
Your planes work.
He's
that was a real challenge to fly.
I'll give him a try.
He's bloody tall. He grew up. Hey, you obviously know to yawn when you're landing and that kind of stuff, right, Pete?
Oh yeah, none of that.
The basics. Yeah.
But like you say, it's worth a try. They're only good for a couple, like 1 flight per pair. But
I haven't heard of those. I don't think Donna has. The Amazon people come to our house 3 times a day, so I'm sure.
Yeah, they do here too.
Yeah. Then I take her
by name.
Then I take her 3 times a day to return all that shit. So excuse me.
Yeah.
Seamus, quit laughing. Okay, guys.
All right, guys.
Anyway, yeah, maybe we should meet some in the summer. let us know, Roseanne. You know, if Pete's willing.
Absolutely. I'll do whatever you guys want.
For me, I just felt comfortable knowing I could contact you.
Yeah.
Thank you.
Well, it's good just to, you know, I try to lighten it up a little bit. We used to do that when we were in the conference room some as well. The best thing you're missing are Lynn's hugs. Lynn's hugs were the best. My wife warned me as a GM executive about 20 years ago, I better cut that SH out or get my ass sued. So I had to stop the hugs. I'm a hugger too, but
yes, you are.
My wife pulled the plug on that one. It's a lawsuit. It's a lawsuit. GM
guys.
Yeah.
Well,
Have
we'll
a
have to
great
figure out a
summer,
way to
everybody.
give a party.
All right, bye, guys.
Thanks for
It's
sticking
fun.
with us
Good
tonight,
seeing
man.
you, Lynn and Tim and
nice to see you,
Pete
Melody,
and
and
Roseanne and
Heidi.
everybody else
Bye,
who's out
Barb.
there.
Bye.
Bye-bye.
Thanks, Tim. Thanks, Pete.
Bye-bye.
Thanks, you guys.
Good night,
Thank you.
everybody.
Night.
Peter.
Good night. Thank you.
Thank you, Tim.
Thanks, Vanessa.
Thanks.
Nice having you, Tony.
Thank you so much.
You're welcome. Good night.
Good night. Bye-bye.
Bye.